Hi, I'm Dr. Nathan Tanner, founder of the Airway Center. Today I'm going to discuss the history of sleep apnea and jaw development and how this is all related. Historically, people had fully developed airways, lots of room for airflow, lots of room for oxygen, good breathing when we're active, running, hiking, and good breathing when we're sleeping as well. Now people are more and more getting smaller airways, narrowed spaces, more collapsible airway with less airflow. Some of the common problems associated with a smaller airway is allergies and asthma. Anytime somebody has restricted airflow and need to open up their airway, commonly people with heavy allergies or with asthma have smaller airways. These are some of the signs and symptoms of many children and adults that have airway issues: ADD, ADHD, bedwetting, difficulty in school, mouth breathing, restless sleep, snoring, delayed or stunted growth, nightmares, low IQ, chronic allergies, crowded and crooked teeth, dark circles under the eyes, swollen tonsils and adenoids, daytime drowsiness, depression, anxiety, fibromyalgia, obesity, hypertension, aggressive behaviors, bruxism, which is grinding or clenching, cardiovascular disease, Alzheimer's, dementia, opioid addiction, diabetes, cancer, and premature death. Research shows that 9 out of 10 Americans suffer from one or more of those conditions. This is one young man looking at his face and his jaw. Is he healthy? You can see his lower jaw is set back a little bit. He has a little smaller airway. And at some point in his life, he's going to have airway and oxygen issues. Here's a young lady. She has bags under her eyes. Her face isn't developing forward enough. And this is from a lack of sleep. There's another young man. He's got his chin is kind of tightened up a little bit. He has kind of smaller lips and underdeveloped jaw structures. So here's some other kids. You can see with their small faces and their underdeveloped jaws, the lack of sleep. And that's what this is really about. If orthodontics is just about straight teeth, it really doesn't matter what age you treat people. We can straighten teeth at any age. But when we can help kids sleep better, as young as possible, people can improve their sleep. It's going to have a positive impact on their life and quality of health. This is a video of a young man that struggles to breathe while he's sleeping.
That was holding it. He's still holding it. He's trying to take in air. There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath, and now he's going to gulp again. There he goes. That was it again.
So while we're sleeping at night, if there's an underdeveloped jaw and our tongue collapses back, this is what happens every night for a lot of people. And kids or adults, this disrupts our quality of sleep. When we have REM or deep sleep, we don't fully rest and restore when this kind of breathing is going on. So here is some signs and symptoms. And the underlying causes of these things that we discussed is a compromised airway, which is from the underdeveloped upper and lower jaws. Some of the factors are soft food diet, processed foods, weak facial muscles, weak tongue, mouth breathing, low tongue posture, and excess sugar intake. Has it always been this way? Historically, people's jaws have developed forward without any kind of crowding. So over 100 years ago, nobody had crowded teeth. Nobody had impacted wisdom teeth. Now we get kids where the permanent teeth are coming in behind the baby teeth. Jaws are very underdeveloped, a lot of crowding. Right here, the permanent teeth coming in behind the baby teeth. And this is vertical growth. So this is the upper jaw growing down instead of forward. The more the jaws grow down, the less the forward growth and the smaller the airway. So how has all this happened? Dr. Robert Corricini and other anthropologists have done research and published studies on how this is culturally based, not genetically based. So as soft food diets increase in a population, within the first generation, 50% of kids have crowded teeth. The second generation, 70%, and by the third generation, 85% of kids have crowded teeth. So around the world, rural populations with heavy breastfeeding, hard food diet, little to no sugar, have little to no incidence of crooked teeth or degenerative diseases, and they have well-developed upper and lower jaws. And this shows that it is acquired through cultural changes, not genetic. So it takes 27,000 years for a genetic mutation to express in a population, and how fast this happens each generation shows it's really from our environment, not from genetics. But our environment and our diet, specifically sugar and the way we breathe, affect our epigenetics, or the expression of our genes, which is a big factor in our jaw development. So why are so many children suffering? So the change in the diet, processed foods, crowded teeth, soft diet, high sugar intake are many of the factors. So instead of kids growing up on good vegetables, kids more and more are getting excess sugar, poor nutrition, and soft food diets. So in the 1900s, the average person ate 6 pounds of sugar a year. By the 1980s, it was over 150 pounds of sugar a year. So today, every 2 weeks, we get what used to have been 1 year's worth of sugar. Every 4 years, we get what used to have been 100 years worth of sugar. So the amount of sugar and the effects that causes on our bone development and our gene expression is not good. So this is a righttogrow.org. This website has a video that talks about our jaw development, how it used to be, how it is now, and how it affects our breathing, and what needs to happen as far as growing the upper and lower jaws forward to get the back of the tongue forward to open up the airway and maximize our breathing and airflow. Normal facial growth ideally is in a forward direction, and these lines as we grow come forward. Less than ideal is coming downward. So as the jaws grow down, it leads to a smaller airway space. So by 2 years old, our jaws are 55% developed. By 4 years old, 70% developed. And by age 12, almost fully developed. So the younger we can start changing the direction of growth from a downward direction to a forward direction is going to help improve the jaw development and the airway of the patients that we see. So this is an underdeveloped jaw, smaller jaw, less room for the tongue. Fully developed jaw has more room for the tongue up there. Straightening teeth can make the teeth look pretty. It can straighten them up and relieve the crowding, but it doesn't always help the airway or the jaw joints. Dr. Christian Gimeno is the father of sleep apnea. He's a cardiologist from 1970 to 2019, and when he was at Stanford, he started seeing complications in his patients after heart surgery. And what he would do is he noticed there's breathing disruptions and discovered that it's caused from sleep apnea. When the tongue gets pulled back in the airway, there's less airflow, and that causes less airflow causes stress on the heart. Less airflow causes stress on the heart, and so when he was able to take care of their sleep apnea, they had less surgery. So Dr. Gimeno found that by helping people breathe better, get better oxygen, decrease the stress on the heart by eliminating the sleep apnea, they would need less heart surgery. How he did that was first defining obstructive sleep apnea, upper airway resistance syndrome, and the apnea-hypopnea index, which is how many times we have disrupted or a complete cessation of airflow. And his first treatment was a tracheotomy. So he put a hole in the people's throat. He realized the tongue falls back and blocks the airway and blocks the airflow. So he's going to bypass the tongue blocking the airflow with a hole in the throat. People would open this little plug and breathe through their throat every single night. They would close this plug during the day and breathe regular during the day so that they could speak. They could never shower, never go in a swimming pool because there's a high risk of this getting infected that would cause serious problems. In the 1980s, they found a better solution. The CPAP machine, continuous positive airway pressure. So the air pressure is a fan that blows the back of the tongue forward off the back of the throat to keep oxygen coming into the lungs. First, they did studies on dogs. Once they got it up to a certain point, by 1982 or 83, they were using this to treat adults to keep the airway open. Then this began to be used on middle-aged people, and now children often use the CPAP machine. Dr. Gimeno, before he passed away in 2019, he said, if we can make room for the tongue and the mouth, we may be able to eliminate the development of obstructive sleep apnea. And here at the Airway Center, the providers, doctors, and teams help develop the upper and lower jaws forward to get the back of the tongue forward off the back of the throat, make room for the tongue to suction up on the palate, and keep the airway open as ideally as possible.